was a great introduction. I appreciate it, and I am so grateful to be here and that you all came here on a pretty spectacular Friday afternoon. So I appreciate it, and I definitely want to take a moment to thank Taylor and Juliana for hosting me as a visiting scholar at the Gund Institute. This is my second 1 week stint, and it has really been very productive and very invigorating and interesting. So I'm really thrilled that I was able to spend this week here, and I'm thrilled to share a little bit about this topic because I'm extremely passionate about this topic, and I hope we can have some interesting dialogue. So I will start with some context. It is it's impossible to escape the impact of the COVID-19 pandemic. And particularly from a research perspective, as you are all painfully aware, lots of disruptions on research and academia, the world in general. I won't go through all of these, but one could argue that some of these disruptions are also occurring now, and very similar consequences from kind of the lack of clarity and instability that's going on. But the good thing is that there some really phenomenal aspects and changes came as a result of COVID. There's a lot more global collaboration, open science, data sharing, remote sensing, using tools that we can take advantage of without having to go into the field. And virtual, I mean, just think about it. I think we're on Zoom. Are we on Zoom? We're Zooming. That's amazing. There's the virtual collaboration has really enabled unifying colleagues across the globe. And then also it did provide some pretty phenomenal natural experiments. There's opportunities, and those, I mean, just think like 10 years from now, we will all be data points, right, in somebody else's graduate students' research. So lots of opportunities that came out of it, trying to spin to positives. And from a One Health, kind of planetary health perspective, really, COVID had a phenomenal impact on increasing the recognition of those links between the environment, animals, and humans. And as a result of that, really the fields, the disciplines of planetary and One Health have gained tremendous traction, both in funding and global policy, national policies, local policies, and then certainly in academia. So this paper is from 2023, the Castaneda, and they were looking at kind of this growth, this surge in One Health and planetary health literature. And so it's the relative number of publications by year. And as you can see for One Health, I don't have a pointer, but so the last 2 years, 20 and 21, there was 137% increase over the previous 2 years, so 2018 and 2019. And then for planetary health, it was 170% increase. And note the scales are different, a lot more One Health publications overall. Planetary health is a fairly new discipline, really. It's kind of was launched in 2015 by the Rockefeller Foundation. So, but still impressive numbers and growth in both of these areas. For One Health, not surprising, a lot of it was dominated by infectious diseases, and then a planetary health, much of it was on climate change. And the same authors, so the formatting did change a little bit, but that's okay. We changed from Google to PowerPoint. The same authors did this kind of keyword co-occurrence network, and I really like, I'm a visual learner, and I like figures like this. you can clearly see there's One Health and then Planetary Health. One Health kind of cleanly separates into different themes. You know, it's very traditional. One Health works on zoonotic diseases, infections, somewhat spilling into the bacterial infections and antimicrobial resistance, which is the slow moving pandemic that we should all be very much aware of. And then Planetary Health on the right, you know, it's much more mixed and kind of a holistic approach with looking at a lot of those connections. And normally I'm not one to really parse apart, separate the distinctions of these disciplines, but I do appreciate from a research perspective, you want to have a framework and that can be useful. I pulled this figure out just because I liked it. And it shows some of the priorities for Planetary, One Health, and then also Eco Health, which is another division. And if you actually dig into the literature, I mean, there's all sorts of healths that are popping up, as it does when, as an academic discipline and area matures, right? You start seeing a lot of that kind of splitting, not unlike religious institutions, right? You get a lot of splitting. So that's there for your reference if you would want to take a look at it. So now I want to kind of dig into impacts. When I was here, so I was here last semester at the end of spring semester in April, and a surprising number of changes have occurred or announcements have occurred since then. And I'll just highlight a couple of them. Probably one of the biggest ones is that the pandemic agreement was adopted at the World Health Assembly in May of 2025. This was a very long negotiation, like over 3 years. And it was a lot of controversy over including how to ground it in One Health and what is the definition of One Health. And I'm thrilled that they actually included the kind of broader comprehensive definition of One Health, which includes very prominently ecosystem health. It really emphasizes the importance of that, the health of the environment, which is fantastic. It's, I think, quite a big win for, you know, a global agreement like this. I will note that there was, I think originally at the Assembly, 125 member states signed. The United States was not one of them because they have pulled out of the World Health Organization. Another big announcement was that the Lancet released their One Health Commission, the big report in August, just recently. And this also was a huge endeavor. It started in 2019. A ton of work goes into these big commissions, and they tend to have a lot of impact on research and on like policy decision making. They get cited a ton. So this is great that it has come out, and it really kind of reframes or frames One Health very broadly as this this framework to manage systematic risks and to support societal resilience. So it's reframing or positioning One Health squarely in the domain of socio-ecological systems. So really kind of pulling it from the grasp of the public health sector and trying to elevate the importance of the ecological sector. And by doing this, it really is becoming more aligned with the kind of the approach, the framework of planetary health. So I can envision there's maybe some merging, you know, things. It's always dynamic processes, But it's great to see, because One Health has, like globally, this has a lot of traction and a lot of name recognition. So it's nice to see that it's getting this broader attention. I won't go through these. These are here for your reference. You will have the slides. You know, a lot of these reports produce their recommendations, so there's not anything here that's totally revolutionary, but I do like that they included the global economics, really highlighting the importance of the private sector, you know, supporting research, but cultivating the enabling conditions for research. And this is my favorite, is achieve a One Health literate global citizenry. And I think that alone, if we can achieve that, that could have really phenomenal impact on the relationship that people have, society has with nature. And this, you probably are pretty familiar with seeing this. This report, this Planetary Health Check, kind of a report card, came out in 2024, so a year ago, and documenting that we're surpassing or exceeding kind of those safe boundaries, or those planetary boundaries, for about 6 or 7, depending on the interpretation of those processes. I'm not going to go through that, but just to highlight that this got a ton of publicity when this came out. So this is a report in the Wall Street Journal, an article in the Wall Street Journal, and the World Economic Forum, you know, traditionally pretty conservative outlets, and they covered this in comparison to the pandemic agreement and that Lancet One Health Commission. That both of those received very little attention in the media in comparison. You know, we're at very different times at the moment, so just not surprising, unfortunate, but not good. A couple of other things, just highlighting the formalization of these disciplines. The Planetary Health Alliance released its Planetary Health Roadmap and Action Plan, really highlighting the maturation of the discipline. And then also the Johns Hopkins Institute for Planetary Health, it was formed last year in 2024, and they released their first annual report in May. You know, that they're probably going to be a major player, right, in this area, so definitely worth. And their website is actually phenomenal. They have a ton of information, as does the Planetary Health Alliance. Really useful information. I think this is going to have an impact, so keep your eyes on that. All right, so a lot of movement in the last year on One Health and planetary health. And I want to now just dig into some case studies. The first is a very traditional kind of One Health example, and this is regards spillover prevention. And in this case, it's for a Nipah virus, which Nipah virus, along with Hendra virus, they are paramyxoviruses. That's in the same family as rabies. They can cause severe flu-like symptoms, and then can progress to encephalitis, and in many cases, they can be fatal. Now, in this is a paper from 2022, Gazelle et al. I'm pretty sure this is in primarily from Bangladesh, but you can see there's various pathways of contamination to people. This paper is published in Pathogens. So it's not surprising, like they're really focusing on the human side, right? Like, how are humans getting the disease versus the bat, which is where, you know, we are kind of more interested in that side here. And it's very typical for that to be the case, where in human medical journals, you tend to just see the, maybe where the wild animal source comes from, but not much about the disease dynamics within that wild animal host. But fortunately, there are some folks digging into this. And this is a paper by McKee et al. From 2021. This is a Nipah virus in Bangladesh. These authors are part of Raina Plowright's lab, who is a really phenomenal disease ecologist. She's now at Cornell. She's originally from Australia and has been studying disease ecology in fruit bats for decades. A lot in that region, kind of Australia, Southeast Asia region, and a tremendous understanding of the population dynamics of the species, and then also the relationship with the diseases. So in this case, what they've identified through kind of long-term studies, a long-term collection of data, they detected that historically, like these bats, like many bats, they like to aggregate in large populations, like in large roosts. And what happens, I'll kind of simplify this, but what happens is with deforestation, urbanization, they're losing those big roosting areas, so they have to break up into smaller roosting sites, feeding sites, and to try to find food, they have to go to where the food is, which is often like fruit trees in human-dominated areas, so in agricultural areas or like backyards in urban areas. So they've detected that this has been kind of a long-term process, kind of slow deforestation over 100 years, and now they're predominantly in these smaller patches. This is another study from the same lab, Raina's lab. This is Ebby et al. In 2023. And they're looking at Hendra virus, which is in that same family in Australia. So it's the year by kind of the winter months, like they're in winter in June and July. So they're looking at the timing of the spillover events in relationship to the presence of the large flowering trees and those large aggregations. So what you have to see, because you just notice they're dark lines and then lighter lines, and there are lots of pink dots. So the pink dots correspond to when there are spillover events. And the dark lines are when there are large aggregations, so lots of food to eat in the flowering trees. These bats feed on eucalyptus trees. There's like 100 species of eucalyptus or more. It's pretty phenomenal. So those are the dark lines, lots of food, lighter gray lines, not so much food. So you can clearly see there's a correlation between pink dots and lighter gray lines. And what they found is when there's a strong El Nino effect, it's resulting in the food shortages. Those trees aren't flowering. Their populations are having to go out and search for food. So they're kind of splitting out into smaller groups. They're going into the urban areas or agriculture areas, and that's when you're seeing those spillovers. What they've also found, and this I find really cool, is for whatever reason, if there is a strong winter flowering pulse, like maybe there's some rain or something that enables the trees to flower, that will attract the bats. And then that actually mitigates the spillover risk. So it really shows like this very rigorous research where they've been able to build on the understanding of the bat biology and ecology and the disease dynamics to get a full understanding of this scenario. And then another paper, this is from Raina's first author, and this one came out 2024, and it's jumbled, so you don't need to see it, but I do like it. It's a pretty cool figure. What they're really arguing, and this, again, is not a new argument, but they at least have the data to back it up. right? So they're arguing that, pandemics originate in ecological systems. You need to have those ecological approaches be part of the kind of comprehensive, balanced pandemic prevention strategies. And with that, their research, they're really able to target, like, what should those interventions be? Instead of like, oh, we can't cut down the forest, they are giving targeted guidance for those decision makers and policy makers. So plant or restore areas of the trees that they like to flower on, particularly ones that flower in winter, like the eucalyptus trees. Apparently they flower all year. Like, there's different species that flower throughout the year. So make sure that there's enough food for them throughout the year so they stay in those forested areas, protect their roost sites in their natural habitats. And you can imagine, like, this is for a specific disease, but this is what we need for planetary health threats, One Health threats in general. Getting really detailed information so we can give to policymakers, like, these are the dynamics. This is what you can do to try to mitigate that risk. All right, so case study 2 involves mental health. I think we're all aware, in the news, there's been a lot of attention on mental health. It is kind of a global crisis that we're seeing, particularly with youth and the like eco threat from all of the natural disasters and climate change, anxiety. So these authors, Kumar et al. In 2023, they were looking at, they did a series of models and then at the end did a scenario analysis. They looked at the percent change of annual societal costs of mental illness that could be attributed to those changes in the health hazards or climate hazards and exposure to pollution and then access to green spaces. And they predicted it up to 2025 and relative to 2021. And I mean, the important point to see is that the top frame is much more purple. It's very densely colored and indicating that there's going to be a large impact on mental health from those rising climate hazards. And kind of intuitive, but they're documenting it. And this was a kind of a systematic review. What they also found is the global additional costs of mental health illnesses are estimated to reach almost 500 million, over 500 million, billion by 2020, which is not insignificant, particularly because we know, I mean, where are those threats concentrated in the map? A lot of those developing countries don't have comprehensive mental health provisions and support for patients. So moving on to this study, I like the that a potential solution to mental illness in addition to traditional approaches is kind of a planetary health solution. And that's nature-based kind of outdoor activities. This again, it's not new. Forest bathing has everybody heard of forest? Who has not? Well, forest bathing is a thing, right? I don't want to call people out. But it's been going on for millennia. So it is something that we are aware of that can help people feel better. Quantifying it and getting it out in a rigorous way to influence decision makers in the public health, human health industry is the key, right? That's kind of the challenge. So this paper was good. It was a really comprehensive systematic review and meta-analysis. They went through tons of papers. They pulled out 50 that remained in their analysis, and then a subset of those. I just pulled out the subset of the randomized controlled trials. RCTs are the only thing public health. I won't say the only thing. The type of studies that have the largest influence in human medicine, right, are those randomized controlled trials. They have the most influence and will be more respected than other types of research. So they're pulling out just those, the RCTs, they showed that, you know, those nature-based interventions really did improve quite significantly depressive moods, it reduced anxiety, and also reduced the negative affect, which is cool. So how can Planetary One Health support mental health? So Vermont, we have to be so grateful that we're in Vermont. In 2015, Vermont launched this Parks prescription program. From my understanding, it's actually not continuing at the moment, but it was a public-private partnership where doctors could, or really like the Department of Health could collaborate with doctors' offices, and doctors could prescribe, you know, get outside. Here is a pass to a state park. And this has been duplicated. There is a national version of this for national parks. And so this has gotten a lot of attention. And also in Vermont, Vermont is the only state that provides licenses, or you can get a license to be a naturopathic physician, to cover naturopathic medicine. Like you can list your primary care physician, that physician could be a naturopathic physician, and it can be covered by insurance. Like Blue Cross Blue Shield is one, but like most of them cover these naturopathic physicians. And what they can do, those physicians can prescribe you to go out and have some sort of nature-based intervention. Unfortunately, the insurance companies, from my understanding, up till now, pay for the visits to the naturopathic physician, but not, like, they wouldn't cover the entrance fee to a park. But this is a step, right? Another step, and this is kind of a cool example, is BUPA. And this stands for the British United Provident Association. So it's a transnational global insurance company. And they're very progressive. They're doing a lot of research on air pollution and health. They're advocating for urban greening and clean air policies. And in their buildings, because they do have their insurance offices, but then also the hospitals where they work, they support architecture, biophilic architecture, really getting nature into those buildings. And they're seeing, you know, shorter recoveries and improved mental health outcomes as a result of that. And just recently, so this was in July, just this past summer, they launched this program. It's of 22 cities, like Berkeley is one of them, where they're working on this global partnership to really strengthen urban resilience with respect to public health and prevention, using that kind of planetary health lens. So it's brand new, but you know, the fact that we're seeing international insurance companies really thinking about this, I think, is a very good sign. Okay, why do I harp on insurance companies so much? Well, because like, just look up the biggest companies in Vermont. Okay, so they have a big impact, and like I see them as they have to be part of the solution. They're uniquely positioned to address these risks because they work at that interface finance, risk management, and protecting society. The human health, I mean, if you just think about it, like the human health insurers, they benefit when we're healthier, right? So it's in their best interest. And if we know there's the evidence that healthy environments reduce the burden of disease, you would think that insurers could or should support ecological countermeasures as a form of like upstream risk management. It's more cost effective and a great preventive approach. Okay. So another case study is well-being economy. I have to thank many of you that for introducing me to this. The links are very clear in my mind, and in the descriptions that they share between well-being economy and planetary health. In the planetary health roadmap, they say specifically the decline in planetary health is rooted in our economic system. And then if you look at the Lancet One Health Commission, they're a little more assertive. They said the prevailing anthropocentrically oriented global economic system is inherently antithetical to the One Health goal of equitable, sustainable, and healthy socio-ecological systems. So you see their opinions quite strongly. But I'll just say like the planetary health and One Health provide that scientific foundation for the well-being economy. Prosperity doesn't equal growth. It really more equals healthy society, healthy people, healthy planet. I want to get into research needs, and we can kind of have this open in the discussion part. But I do want to, I'll be going over a tiny bit. Since I've been here, I've had a lot of questions like, oh, what are you up to now? And so I did want to share kind of like what I'm doing, or at least what am I ruminating on. And really stemming from my visit here last semester in spring and having a lot of conversations, I've been thinking about regional resilience and the building of regional resilience to climate change, specifically in New England. And we know that this area is warming faster and sea level rises higher than global average. This region is highly dependent on a healthy environment for our economies, right? There's agriculture, forestry, fisheries, ecotourism. We are nature-based economies. And we also are really small states. We have small budgets, and we're burdened with the increasing number of natural disasters and having to pay for mitigation and adaptation as the federal government decreases support. So it seems sense, it makes sense to me. We should be working together. So what do I think that this regional coordination could look like? What goes into it? Well, sharing information, developing ideas, learning from like Jillian's, doing the impact assessment. Other states are interested in that, like sharing all of that, leveraging the limited resources that we have, and really thinking multi-sectorally how we can benefit people and the planet. And as PWE, which is planetary health and wellness economy, right? Like using those lenses. And then also like harmonizing New England specific approaches. What we use here isn't going to work in Southwest United States, but coordinating our approaches so whatever we do here in Vermont doesn't at least undermine what's going on in New Hampshire. So that's kind of where I'm thinking, and I'd love to chat more about that if there's interest. Now, some research needs. There's a list I pulled together. The first one goes to what I just mentioned, like how could we nurture a well-being economy based on kind of planetary health ideals within a region like New England. There are governments, countries that are based on well-being economies now, from what I've read, recognizing I'm pretty ignorant about anything economic, but Iceland and Scotland, Australia, New Zealand, like they have adopted this well-being economy approach. So can it be done for a region in here in the United States? And then thinking about landscape scale interventions, those ecological countermeasures, what works? Where does it work? How could it improve both humans and ecosystem health? We need more research on that. How to shift behaviors, behavioral economists, we need your help on, how can nature-based solutions be implemented in a way that's equitable and durable and then actually effective. And then what are the population level dailies? If you're not familiar with dailies, this is something that all human medicine folks use. This language is disability adjusted life years. We have to be able to work within their measuring monitoring system. And how can we merge that with like the well-being economy aspects, like subjective well-being gains from nature-based interventions, and then really coming up with those metrics, like how can we get those metrics on the same scale, some sort of common currency, so we can start measuring and sharing our results in a way that our human medicine folks will understand and appreciate.